to Sophia's webinar on HiAP and your community. So I really am excited about this webinar today. Our speakers have worked hard on these HiAP products that they're going to be presenting today. First, we will have the fearless team of NACCHO and ASTHO, represented by Ali Aslam and Don Wind. And then we will have our two lovely representatives of the HiAP and Equity Work Group here at SOPHIA, Audrey Boehner and Emily Suter, talk about the Health and All Policy Selector tool, which their work group has been working on for over 18 months, almost 2 years now, right? Yeah, they put a lot of love and care into this. So I'm really excited to welcome you on behalf of SOPHIA. For those of you who don't know me, I'm Sandra Whitehead, and I'm the current president of SOPHIA. And I am going to go ahead and turn it over to our first set of speakers, Ali and Don.
Well, once again, thank you, Sandra, for the introduction and for talking to the people while we are getting stuff ready. So, as Sandra said, my name is Don Wind, program analyst of the Public Health Policy team at NACCHO, and presenting with me is Ali Aslam from ASTHO. And our two organizations collectively present the majority of the counties, cities, states, and territorial health departments in the United States. So I will start with going through a quick overview of health and all policies, and we will then move on to explain the tool itself. And at the end, there will be some room for questions, or to possibly already share experiences using the tool. It's good to note that this Health and All Policies Evaluation Tool is supported and made possible by the Centers for Disease Control and Prevention. So this might be a repetition for a lot of you, but I want to start with the definition that we have for health and all policy, which we define as a change in systems that determine how policy decisions are made and implemented by the local, state, and federal governments to ensure that policy decisions have a neutral or beneficial impacts on the determinants of health. So basically, health and policies is based on the principle that our health is largely impacted by the social determinants of health, which are defined as all the non-medical factors that influence health outcomes, or the conditions in which people are born, grow, work, live, and age. For example, the built environment makes up a community's physical design, which is informed planning processes and policies. It affects our water and air quality, access to healthy foods, and opportunities for physical activity. In the same way, how we structure our society determines how we define resources and affordability of food and exercise. Many policies put in place around these non-health factors impact the community's health, but are made by actors outside of the public health sector and don't always take the community's health into account. Decisions made at all levels of government, from federal to state and local, and by different agencies, impact health. So health and all policies is also the understanding that most of what impacts your health is decided outside of the health sector. And this is why health and all policies is an approach based around the need for multi-sector partnerships, where you bring together stakeholders across areas of expertise, like public health, housing, transit, and others, and together define mutual goals by explaining how other organizations' policies impact health, but also by listening how including health might impact your partner's goals or bottom line. Health and all policies is most successful when you can create a win-win situation. It's also very important to involve the community whose health you're actually protecting. Especially for state and local health departments, a good relationship with communities in their jurisdiction is essential. And a good example for involving community is by the use of community connectors or ambassadors, who can be helpful in understanding and reaching your communities. And they're often people who are integrated in their communities and speak their language, both literally and figuratively. They know what the communities meet and are a trusted face and are in a good spot to represent the community to the health departments and represent the health departments to the community. Any approach to address health impact in the community should be community informed and if possibly community driven. Well, I see that we're up. I'm currently at slide 6. Yes, thank you. One slide back. So to fully understand health policies, it's important to note the importance of health equity in this approach. Collaborative approaches like health policies applied broadly without an explicit focus on health equity will not attain the goal of health for all. The definition of health equity that we use at NACCHO was created by Dr. Canary Jones. And she defines health equity as the assurance of the conditions for optimal health for all people. And she states that it requires valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. So putting health equity at the center of decision-making is not always easy. And sometimes it can be hard to understand the adverse effects even health promoting policies can have. I always use an example of an adverse effect that was seen at the local health department working with different stakeholders on moving lead from houses. The moving lead from houses is an important priority, especially as it's mostly vulnerable populations who are affected by it. The potential adverse effects from moving lead, which was identified by the health department, was that removing lead from housing could be such an improvement that would lead landlords to increase their rents. And this could lead to the same vulnerable populations the health department was trying to protect to potentially lose the roof over their heads with all the negative effects on health that has. In the end, the health department had to add safeguards into contracts with landlords to prevent this. So what is health and policies? To ensure that health is being considered throughout the decision-making process, we need to find ways to continue to ask the question, how does a prospective decision potentially impact health and health equity? Ultimately, health and policies is upstream. In other words, we are trying to change how we implement policies, programs, and services so that we consider the health impacts early in the decision-making process, promote positive health impacts, and minimizing potentially negative ones. Health and policies is also comprehensive. It involves all sectors from the Chamber of Commerce to the health department. It involves the entire decision-making process from development to evaluation. And it involves all levels of government, from local to federal. So to give a quick summary, the objective of health and policies are to create a safer environment with fewer risk factors, to improve health equity, to increase health and well-being. And this can be achieved by involving multiple non-health sectors that shape our social and physical environments, such as transportation, planning, and public works departments, achieving an understanding of the decision-making process that the health is considered during development, implementation, and evaluation, and by coming together to define mutually beneficial goals. So, good health is a universally shared value, and addressing the terms of health is a shared responsibility. Population's health cannot be improved without working collaboratively with the sectors that create social and environmental policies. This means that everyone has a role to play. Public health professionals specifically have a unique role to play as subject matter experts on how to better understand the social and environmental conditions of health. Health departments impact our life every day by promoting and protecting the health of people and the communities where they live and work. They are best equipped to understand how policies made in non-health sectors affect the health of their community. And all in all, they have a natural role as the driver of health and all policies.
Great, thanks, thanks, Don. I'll jump in here and appreciate everyone again for joining today, and thanks to the SOPHIA team for again giving us an opportunity to share more about this health and all policies evaluation tool that we released recently, and I'm happy to be able to showcase that for you all to take a look at today. Apologies again for the technical difficulties. Hopefully, my internet holds on to get through the rest of this presentation. But again, my name is Ali Aslam. I'm an Assistant Director of Environmental Health at ASTHO. ASTHO is the Association of State and Territorial Health Officials, for folks who may not be familiar. Similar to NACCHO, we are also a national nonprofit organization, and we aim to serve state and territorial health agencies. So I'm going to kind of start by talking about the frameworks that informed the tool that we've created. And I'll go through and kind of share some screenshots as well to give you a better feel for some of the different components of the tool. And then we'll also talk through a couple of examples for state and local jurisdictions that hopefully could be helpful for folks as they're thinking about, getting started on their health and health policies evaluation journeys, and really digging into this tool. So I'll start with the first framework, which I'm sure many of you all are familiar with. It's the 7 health and health policy strategies, and I'll quickly run through each of these strategies. The first is, as I'm sure many of you know, is developing and structuring cross-sector relationships. So, in this strategy, we're really looking at relationships that could either be informal or more formal relationships, and could involve working on activities such as developing task forces or setting up different committees involved in or that involve partners from different sectors. The second strategy is enhancing workforce capacity, and this strategy involves or could involve activities like putting on staff trainings, creating opportunities for staff to interact across sectors or across programs, and potentially also involving hiring of non-traditional staff. The third strategy is incorporating health into decision making. So in this strategy, we could look at activities that involve conducting cross-sector needs assessments, engaging in kind of broader strategic planning activities or priority setting activities, or simply developing shared goals around public health across different sectors. Another strategy is coordinating funding and investments. In this strategy, we can look at potentially developing joint funding opportunities, setting up cooperative agreements or contracts between different partners. We also look at the strategy of integrating research, evaluation, and data systems, which could include the use of data and storytelling to communicate how these cross-sector policies could potentially impact social determinants of health, as being, one of the goals of using a health and health policies approach. Another strategy is implementing accountability structures, which would involve, assigning responsibility of, long-term goals and promoting transparency between partners. And lastly, synchronizing communications and messaging. So in this strategy, we're really looking at developing, kind of a unified messaging strategy and kind of establishing common language amongst different partners. So we'll go to the next slide. The second framework that we use to incorporate into the tool is the 4 implementation phases, which ASTHO promotes. And when we talk about collaboration in health and health policies, we really like to break it down into 4 phases. And we've also heard this concept referred to as the ladder of engagement, or there's other kind of language that we've heard that is used to describe this concept as well. But the general premise is that we want to acknowledge that folks may be working in environments where collaboration may exist on a spectrum from least collaborative to most collaborative. And so we've assigned these 4 phases of implementation as a way to represent that spectrum. So for us, the reason we feel like, actually, we're going to stay on the implementation phases slide. Thanks, Sandra. So these phases are important because, we want to acknowledge that, one, health and health policies work looks different depending on where agencies are and who they're working with. And secondly, we also want the tool that we've created to be able to meet health departments, again, where they are, and to provide, hopefully, example activities and metrics that can be useful for health agencies across all those levels of engagement. So for the first phase, it's the informative phase or the informational phase. This is typically where partners engage in information exchange. And usually this stage exists at the early stages of building a relationship where folks are really trying to get to know one another and may involve, one partner potentially giving presentations or, sharing educational materials with others about the work that they do. The second phase is the consultative phase, and this phase usually could involve, one partner providing feedback, offering advice, or asking for input from partners, where one agency typically is still kind of in the position of driving the initiative and is engaging others, and may include, activities where folks are working or participating on advisory groups, or simply just, kind of offering ad hoc consultations. The third phase is the engaging phase. And in this phase, usually the lead agency invites partners to work collaboratively on a policy implementation effort, and might look like, a joint task force where there still kind of is this one partner who's really the main driving force of the initiative. And then in the final phase, the collaborative phase, is typically where partners tend to share more responsibility in decision making as well as implementation. And usually there is, more of an emphasis on social determinants of health, typically we've seen, and also involves some shared accountability between the different partners that are involved in that collaborative effort. So that's, a pretty quick overview of those two frameworks, the 7 strategies and the 4 implementation phases. And so on the next slide, I'll show how these fit together in the evaluation tool. So we structure the tool by each of these 7 strategies, and this is an example for the strategy of developing and structuring cross-sector relationships. Under each of those strategies, so for each of those 7 strategies, we stratified activities as well as outcome metrics and process evaluation metrics based on these 4 implementation phases. So you can see from left to right, those are the 4 implementation phases, and that's how we've structured the tool for each of those 7 strategies. So under each phase, we've included, again, example activities, example process metrics, as well as outcome metrics for both state and local health departments. And the notation that we used, which you can hopefully see on the screen there, you'll see the letters A, P, and O. A represents activity, P represents process metric, and then O represents outcome metric. So one of the main goals of this tool is to provide health departments and partners with as many relevant examples as we could to support health and health policies evaluation. So as you can see on this page, as well as other pages in the tool definitely has a lot of metrics, but it's certainly not meant to be exhaustive. We really wanted to try and offer as many examples as we could so that practitioners in the field could be able to brainstorm and adapt based on the context of their jurisdiction and the particular evaluation goals that they have. So this is hopefully kind of a starting point for folks as they're looking to develop their evaluations. Next slide. So knowing kind of what information is in the tool, we wanted to share just a couple of scenarios for how we think that this tool could be used in practice. And we'll start with a state scenario. So in this scenario, we have a state health agency who is collaborating with a state housing authority to establish a health equity task force. And this task force will include partners from state and local agencies, as well as community-based organizations and faith-based communities. So in this example, the state health agency has a strong relationship with the housing authority, as well as other partners due to years of collaboration and trust. So for this scenario, we want to look at how we could potentially use the tool to support evaluation. And the first thing that we want to do is to identify which strategy this effort might fall under. And then we also want to determine which phase of implementation that we think this activity falls under, so that we can potentially find some example metrics as well as metrics for a process as well as outcome evaluation. So next slide. So I'll start just by kind of noting that there certainly is no one correct answer. You could definitely make the case for this in this particular example that this state might choose a different strategy or may place themselves at a different implementation phase. It is certainly very fluid, but for the sake of this example, we'll say that this state is looking to develop and structure cross-sector relationships. So we'll say that's the strategy that they're going to be looking to implement, and that because they already have strong relationships in place and shared ownership with this task force that they're looking to create, we'll say that they're going to be in the collaborative phase. So at this point, what the state health agency can do is look into the relevant section of the tool and find example process and outcome metrics that they may want to consider as they're planning for their evaluation. So for example, if we're looking at potential process evaluation metrics, one that they could choose is simply to count the number of institutions that are represented on the task force and determine if over time, if membership is increasing or decreasing. So that's one example of a process metric that they could look at. For a potential outcome evaluation metric, they could consider measuring the strength of their partnerships with the different task force members, and again, see if this is increasing or decreasing over time. And this is something that could be measured in a few different ways. For example, we've heard of folks using partnership mapping tools. Others have also, talked about using qualitative data collection methods like focus groups or surveys, et cetera. So there are certainly, a number of ways to be able to collect that information as well. And then lastly, we want to identify a potential long-term impact on health equity, which can hopefully help to provide, kind of an aspirational vision or a goal for jurisdictions to work toward. So in this example, the state health agency may consider framing, the desired impact that they want to have by their ability to advocate for and implement health equity policies and programs through this health equity task force that they're looking to create. So that was, just one quick example and really a quick summary of the tool and how we've kind of structured it. And so there are some other, kind of components of the tool that I didn't cover that are also included, and we can, certainly send a link to folks who would like to take a closer look. But there is some, kind of supplemental information that's also included in the tool that can hopefully also be helpful. Some of those are some case studies of, kind of state and local health departments and how they've been able to implement, different examples for evaluation, as well as some additional examples of health and health policies activities. And then we also include, for each section, some potential sources of data, as well as, recommended methods for data collection as well. So that was, super quick run through, but hopefully, it was helpful to at least again, get acquainted with the tool. So as, folks are kind of going through and making use of it, be able to have this as a reference. So.
Thank you, Don and Ali. I really appreciate it. I know it was like a quick tour of a very intense and detailed tool. So thank you for that quick tour. And now I want to turn it over to Audrey and Emily to talk about the HiAP Selector tool, which is a SOPHIA tool. I'll let you guys explain the details.
Yes, thank you, Sandra. And Audrey will be sharing the slides today. And so we're excited to talk about a health and all policies selector tool. And I am going to zoom past our definition of health and all policies because I think Don and Ollie did a good job of setting the stage. So really, I want to tell you a little more about our work group. We're a work group that's been around for several years now. And really, we try to identify needs or gaps for practitioners and develop resources to fill those gaps. And we're really about on-the-ground experiences and connecting practitioners. So for the next slide, Audrey, we're working on, as I mentioned, developing resources, right now, a great example, we're working on trying to put together a comprehensive list of competencies for health and all policy practitioners so that folks, if they're hiring health and all policy staff or staff related to that, they'll have a good place to start for writing job descriptions or what the person needs to work on to hit the ground running. And then we also developed a customizable tool, and that's what we'll talk about today, to select the most actionable health and all policy strategies and tactics based on your local context. And then finally, I'll just talk about this briefly. We also are interested in developing case studies and learning from local and state and other organization and their practitioners of how they're implementing health and all policies, because it looks different everywhere you go. So the timeline for our work group, what we've been working on, and Ollie talked about those 7 strategies. That's really where we started, is in using that tool, and we built off that tool, and the work group created a screening tool. And really, when we were thinking about that, we wanted to consider like, what criteria should you use when considering what strategies to select? And then in 2023, in the past year and a half, where we've been looking at what others have done, and we've put together examples and guidance for 36 health and all policy tactics that relate to the strategies. And we put that together through one-pagers. So you can use them together, or you can pull them separately to look at those tactics. And then we took those tactics and we took those one-pagers and we built off that again, and we created a strategy selector tool where you can, pick and choose. And Audrey will show you a little bit later, but it's an interactive tool and it's a really good resource for you to use in your practice. And with that, I am passing it to Audrey to go over that tool. So thank you.
Getting ready to unmute myself, and then I pause screen sharing, which I've never done before. So screen sharing has just been such a good friend to us on this webinar. So like Emily said, the Selector tool has been a long process for us and building on a lot of previous work. This is a screenshot from the web page where we have it on the SOPHIA website, and Emily will drop that link into the chat. But what the goal of the Selector tool then is for if you're new to health and all policies, if you have a general idea, or even if you've been doing health and all policies for a while, but maybe you want kind of a fresh take on how to approach it, maybe to share it with your staff. It puts a lot of the different strategies and tactics that you've heard about today into one place, as well as how to walk through those based on your community conditions or your community criteria. So you can download it from our webpage and then walk through that. And that's what I'm going to switch over. I think I have to, here we go. I'm going to switch over and then show that to you. Oh, did I lose my page? All right, I need to stop sharing and then I'll switch over and do that real quick. Go back to sharing. Thanks for your patience with all of us today, everybody. Okay, so now you've got, this is the Selector tool once I've downloaded it from the website. So it downloads as an Excel file, and the first tab in the Excel file really walks you through everything that you would need to know. So a little introduction, and then these instructions over here. Step 1 is to think about the issue or the decision that you would like to apply health and all policies for. Certainly, if you don't have one pending right now, this is a great tool to just explore and get some ideas. But if you do have something specific, having a more specific example will be helpful as you walk through the tool, because then you'll be answering questions related to that particular decision. So just the example that comes with the tool is that we'd like to use a health and all policies approach for a new development area, a new development plan within our community. And then it'll walk you through the next few steps here on the first tab, but I'm just going to do that verbally and kind of show you how the next steps would go. So the second tab in the Selector tool is where it gets really fun and interesting. Along the top here are 7 different questions related to your community or city, state, territory, whatever the geographic area or issue is. These would be questions that you would answer related to that. And again, a lot of these questions came from earlier work. So we, on behalf of our current Health and All Policies Working Group, can't take credit for all of them. They came from a lot of our predecessors in SOPHIA and in this working group, but we adapted them to make them into this Selector tool to make it a little bit more interactive and easy for new practitioners to digest. So the types of questions you would be asking yourself or your team would be, how strong are the relationships with our potential partners? And then you can select whether that's weak, medium, or strong. The definitions for all of these are here in the Selector tool. So it might seem a little arbitrary, but we do give some definitions that can help you walk through this in a more consistent way time and time again. So I could say we have maybe a medium relationship strength. What resources do I have available? Well, we got a new grant and I have a lot of resources available, a lot of staff time and funds. That we're dreaming now, everyone. What type of decision is this? Well, this is a very specific decision. We're middle in the timeline, and I'm answering these sort of arbitrarily, but all of these different questions, then you would answer decision controversy. So kind of how politically charged is it? How open is the process? Is it very public, or is it something that's happening behind the scenes? And then how much evidence available do we have about health impacts and health issues? How much do we know about how this decision could impact health? So you would select the answers to all of those 7 questions. And then what'll show up here, let me scroll up here. In this dark blue are again those 7 strategies that Ali introduced earlier. And it will list a number. It's not a ranking, but it'll list a number. Higher numbers mean that there's a better fit. So for the answers that I arbitrarily have here, the 2 recommended strategies to start with would be developing and structuring cross-sector relationships and synchronizing communications and messaging. So I can scroll down and get a little bit more detail. So let's start with the developing and structuring cross-sector relationships. That happens to be my first category here, and I'm going to scroll down. So under this strategy, we have a couple different tactics, well, what does it mean if I'm going to develop and structure cross-sector relationships? And there are more options that, again, are weighted based on the answers that I gave at the very beginning. So again, there's a lot of arm waving and nuance here, and I don't want anyone to feel locked into, oh, I can only do number 6 and I better not try number 1. It's just based on some research and also a lot of ground truthing with practitioners about what seems to work best based on the answers I gave and what maybe would be a little bit of a steeper climb to try to attempt based on the answers that I gave. All of these are fair game, and there are others that are out there that you might not see on the Selector tool, certainly, but this is just a way to kind of cue you into, based on the experience of other HiAP practitioners that we've worked with and interviewed and beta tested this tool with over the last couple of years. This is what people would tend to recommend. So for this example, I would tend to recommend support community-based organizations and health sectors to engage in an advisory role. So getting them to start participating in advising on this discussion or this decision. Also a formal committee or council or task force to consider the health effects. So these two they're sort of related in a way. And then again, it gives you all of the other options. Similarly, I could go back up and remind myself, okay, synchronizing communications and messaging was another one that seemed to be a good fit based on the answers to the questions I asked myself. That one happens to be down here at the bottom, so quickly I'll scroll down there. Sorry for the scrolling. And again, it gives me a number of different tactics, and you can see a lot of these seem to be kind of a slightly better fit based again on my answers and give me a kind of a place to get started on where should I be thinking about, or where could I start to be making a plan or putting some energy into inserting some health and all policies tactics into the work that I plan to take on. So we'll have time to answer questions. We just got a little bit more on our presentation, which I want to jump back to. And let's see here. So that runs you through the tool itself. Emily then mentioned that actually before the tool, we worked on an implementation guide. It was a little bit backwards, but that's how it worked out for us. So this gives you a little bit more detail on sort of the how-to and the who else has done some of these things that I might be trying to attempt. This is also right on the same SOPHIA webpage that you can download. And it's 7 one-pagers. These are also all connected to those 7 strategies again. So this is that first strategy that I talked about, cross-sector relationships. And it gives the tactics that are listed in the tool as well. And then it gives you a little bit more background information on what that really means. What are some tips and tricks to get you started? What are some things to be thinking about as you're wanting to attempt this? And then also a really helpful addition are these examples and resources. So it talks about, you can see there's other local public health department examples. There's some links to different databases and data sources, maybe some example policies, examples of a task force or an advisory committee, depending on which strategy you're looking at implementing a little bit more. So this really is a how-to to walk you through or to give you some fresh ideas about all of these different strategies and some of those tactics that might mean on a day-to-day basis of your work. And with that, I will send it back to Emily.
Thank you, Audrey. And I know we're running short on time, but I want to leave you with some reflection questions. And if you have any thoughts on how you could apply the Selector tool in your work, put it in the chat. Same with if you saw a criteria as Audrey was going through the tool that seemed particularly challenging, please tell us. We want to know and how we can provide more support. And if there's one goal that you would like to set for yourself or your organization on health and all policies, let us know as well. And then if there are any resources and tools you would like more help with, that's very important to us because, again, I mentioned this at the beginning, but as a work group, our goal is to really help practitioners and really, be able to provide those tools and resources. Okay, with that, I guess we will close and open it for questions. Or Sandra, do you want me to pass it over to you? Whatever works.
No, why don't you guys go ahead and facilitate your own Q&A? I think that's perfect.
Okay, awesome, Sandra. So any questions for either the first presentation, Don and Ollie, or for Audrey and I on the Selector tool?
I got a question. You can hear me okay?
Yes, we can hear you.
Okay. Well, this is interesting. I think I can find some uses for it. I'm chairing a safety and health committee for in Dayton, Ohio, for a area to hopefully go through some gentrification, and gentrification has both pros and cons, as you know. So I very cautiously use that term. One of the things when I was watching, this is really quite interesting. I was thinking of an old term years ago, maybe before we were as computer savvy and chat GPT savvy, decision tree. Years ago, we wouldn't have had such fancy informatics here, and we would call it a decision are just a thought there. And the other thing is, are there some are there some workshops per se that you are planning or have been presented where you would bring in a couple of different subjects? Like, for example, in Ohio, House Bill 7 has to do with increasing maternal health awareness and benefits. It's a health equity problem, obviously, and I can see that fitting into this. And when we talk about health and all policies, we're talking, this wasn't mentioned, but obviously we're really talking about working with legislative leaders and state governments, local governments to address health problems, and then using what you presented here today as a tool so that we can come forth with the best argument and information. So are there some out there, have there been some uses of this tool in real life that we could study or see the results of and have those people share the pros and cons and ups and downs?
Can I clarify, Jerry, you asking about the Selector tool? Because I know both presentations use the word tool, so I want to make sure that.
Okay, yeah, I know, yeah.
Selector tool? Yeah, okay.
Yeah.
Not that we know of yet. We really, we had a soft launch like end of October, and we got it live on the website. And our, of course, our working group has known about it, but this is kind of our first big public, ta-da. And so this is pretty new to most folks. But I sure would love to hear about that. So everybody here, spread the word as you use this, or if you
Yeah.
share it with friends, like, let us know.
Right.
And as far as workshops, that's not something that we have planned right now. But it does, and it mentions this on the website too. We would be available and happy to provide some technical assistance if people need help getting started, walking through this particular tool, or thinking about something that's more nuanced in their community. That is something that, as SOPHIA, we do want to be able to provide, so that would be a potential opportunity. Sandra, Emily, anything I missed in there to answer Jerry's question?
I said a lot. I said a lot, but you're doing good answering it.
No, I appreciate the question, Jerry. You always have good questions, right? I think at this point, like Audrey said, we are just rolling the tool out. And as people use it, we'll be soliciting, as Audrey said, on our website, testimonials. But I like your idea of offering workshops of how to, or maybe getting folks together who are new to this and walking through the how to use the tool together, and then having them like check in with each other. I think that's something that might be fun to do. But we're hoping that people will pick this tool up and use it to either deepen their practice or, to start a new health and all policies project.
Right. Also, not to hog the whole show here, but you said I had good questions. So the other acronym that came to mind was Health Impact Assessment. And obviously I see these two like conjoined twins or something like that. We had a situation with here in Dayton. Well, you're aware of this. You're aware of this in your own communities. These super duper fuel stations that are being built that take up several acres and disrupt the neighborhoods and the traffic flow. And I could see what you have here being a good cursory assessment tool for sure. And I'm going, when I get the recording of this, and I'll be talking to you, Audrey, for sure, and Sandra, talking to you about this and getting some pointers and maybe a one-on-one workshop. Thank you.
Yeah, I think that's an important point. And we sort of see HIA and some of these other tools like Health Notes and other kinds of quasi-HIA processes as tools of health and all policies, right? Like, because you don't always have enough time to do an HIA before the decision's made, but you can get in a health note, you can do, a quick and dirty. There's a lot of things you can do that aren't full-blown HIA that are still tools of health and all policies.
Okay.
So I'm wondering if there are other questions. I did see a couple of comments in the chat, but they don't seem to be questions. But there was a comment that one of the listeners really liked that you had included the political context. That is such a limiting factor sometimes. Jimmy.
Tell me. Yeah.
Yeah. Thanks for all this, having been a part of some of these through the years and gone away and come back, and it's great to see them. And just kudos to both groups for pulling these, I think, really useful resources together. And so, kind of a thought and a question. Holly and the folks from the first group, I'm curious. My ears perked up. We said it was CDC funded for the evaluation tool, and I'm involved in Georgia in our state physical activity and nutrition award from CDC. And so I'm curious if you guys are aware of, or as you were putting that together, if you're aware of any span, hop, or reach awardees that have maybe used this tool, because each of those, they're not necessarily defined headline as Health and All Policies awards or funds, but they are the funds are very much intended to get folks working in community design for physical activity, working with kind of in breastfeeding space, early care and education space, nutrition systems. So the work is HiAP. It might not be called that. And so as we were looking at this, I was scanning through the tool and sent it over to my evaluation people, but I'm curious if you guys have any top of mind knowledge of folks using it, or applying it within those specific CDC awards.
Thanks for the question, Jimmy. I think, similar to the HiAP Selector tool, this is also something that we rolled out very recently. So this was, I think, officially launched at the end of the summer. So at least I'm not aware of any potential grantees from that program that may have used it. But as you were talking about it, it does seem like there could be some value in making some of those connections. The work that or the office that supported this work was through the National Center for Environmental Health. And so I think, again, I think there could be some value in making some of those, connections and supporting some of that work going forward as well. Don, I don't know if you are familiar with any of those grantees, but from our end, still I'm not.
No, I'm not. I mean, I'm always interested to learn about them. So Jimmy, if you would like to send some information in the chat, it would be great.
Yeah.
Health and policies as a principle is incredibly broad.
Yeah,
So
well,
there's
it might
some
be.
more initiative we follow, but
Yeah, and it might be worth a follow-up as we work with it. I mean, what I popped in my email was like, and this is a CDC funded tool, so they would probably be happy for us to be using it, even though these awards all come out of the Chronic Center. We know that they're building bridges inside the organization, so we can do that in practice too. So that's awesome. And then also for Audrey and Emily, great to see the Selector tool up and live. And then as you guys were talking, was just popping in some answers based on this work I'm talking about for the community design for physical activity. And just to give you a quick validation that it kind of popped out with answers that really align with what ended up in our work plan. And so I'm going to make myself go back and use this tool more intensively as we are rolling out our year 2 work plan under some of that cross-sector work that, again, is not branded as health and all policies, but it definitely is. So the tool is applicable. So again, just thanks to all you guys and look forward to following up as I play with these tools and use them in the real world.
I can't hear you, Audrey. Audrey, I couldn't hear that at all. Could anyone else? Oh, we missed it. I was going to say thanks for the on-the-spot reporting, Jimmy. That's amazing.
I see Anna has her hand up.
Yes, I just wanted to chime in too with a similar reflection. That's really the stage that it would be at now. I live in Yuma, Arizona, Southwest Arizona. I currently serve on 2 different organizations, both of which are oriented towards food systems. One is a food policy council that we call a food alliance because we don't want to scare people away with the word policy. And I just wanted to say, I can see some immediate, that's not technically a health in all policies initiative, but it's a grassroots initiative that's actually being led by the local, well, the county health department here. But I can see some applications of both tools that we can sort of pick and choose to enhance what we're doing. So I just wanted to comment. I just wanted to mention that in case it's helpful to anybody else. And thank you for sharing these. I think it's going to make our work better and easier. Thank you.
Not seeing other questions in the chat or other hands. If you prefer to just raise your hand and make your comment or ask your question, I think we have time for one more. Hey, Lily, I see you.
I see you again. Thank you so much for the presentation. And I also wanted to echo the appreciation of the regulatory political context. So I am based in California, and I work with several communities in air pollution and community air pollution local issues. And so as I'm finding working in the cumulative impact space and the necessity of whole of government, meaning local, state, and federal, I do see some like, you know, potential low hanging fruit where I wanted to ask you guys about, you know, support that you were kind of saying you could provide as we're looking for example scenarios, best practices, so to speak, so that we can demonstrate utility of this in the real world. So I guess kind of what my question is in the immediate term is, as environment clearly affects our health, and then what I'm connecting so far is that community has that, you know, utility of knowledge of what's been happening over the cumulative impact space. I see a lot of land zoning, land use kind of effects in the air pollution context. And so connecting these very disparate sectors with the connection to health and needing all policies, land use, environmental policy, and so forth. How do you see, or do you see a way to like condense this for the public level consumption to, you know, buy community buy-in or get community buy-in for this? Because if we start talking policies and regulations and blah, 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 I see people's eyes kind of roll over like, oh my God, you're boring me. So kind of like to boil it down to kind of that pitch, that's where I think, you know, it would be helpful to get that community, like, you piqued my interest, what else do you have to say?
Yeah, I think I need to bull on that, Lily. That's a really good question. And I think we're just really hitting the cusp of like how to best engage the community. And that's so context specific. You know, every community looks different, how you engage them. But, you know, what you said about, you know, this is just how health influences things can be complex. And how do we make that in plain language? How do we make that digestible? So I think, you know, that's something the work group can add on our list to work on. I don't think there's, you know, I haven't answered today. I don't know if any of the other presenters have some thoughts, but I think that's something we really can start to provide some ways to make this easy, more easily digestible for the community and get their input and really start at that grassroots approach. Any of the presenters have any other thoughts on that? Lily, that's a great question and a great comment.
Yeah, the only thing that I can point to is what I said before. We found it's immensely powerful to use community ambassadors in a lot of programs, just to already get that, not just to communicate the policies or programs you're always starting, but just to get that early, just like just know what community prioritizes and what they want, and build your programs around that. And by having something be community informed, community driven, you're likely already going to be behind the project.
Other comments? All right, I see that we are right at the top of the hour. I want to thank all four of our presenters, and I want to thank all of you for attending. Please keep your eye on our SOPHIA events page. We have more webinars planned for the after the holidays. And again, please go to the site that Audrey put in the chat if you're interested in joining SOPHIA as a member. Have a happy holiday, everyone.
Thank you.